Good evening, everyone. My name is Reverend Sean James. I am the pastor of Salt and Light Church in Philadelphia, Pennsylvania, and the executive director of the City Lights Network. And we are gathered tonight for the second Faith, Trust, and COVID-19 Honest Community Conversation. This is the second of a series of conversations sponsored by the Perelman School of Medicine at the University of Pennsylvania, Black Clergy of Philadelphia and vicinity, and the COVID-19 Prevention Network. We approach this conversation tonight at a critical period in the pandemic that is facing our nation. These are in many ways Dickensian type times, as they are the best and the worst of times at the same time. This conversation comes in the midst of the darkest days of the COVID-19 pandemic, as more than 3,000 individuals have died every day for the last week. Our hospital beds and hospital are overrun, beds are crowded, doctors and first-line workers are overwhelmed. And so we find ourselves at a period right now where the results of Thanksgiving and holiday gatherings have caught up to us. And these are indeed dark days. There is perhaps no one who does not know several people who are personally affected by COVID right now. But these are also bright days. In the midst of this darkness, there is a ray of hope. As just yesterday, the Kaiser vaccine began to be administered to healthcare workers. Just today, the Mrna Vaccine was declared by the FDA as highly effective and that it may actually be able to help prevent the spread. There are two other vaccines that are down the pipeline. So right now we find ourselves at a period of time where while it is dark in our world, dark outside, it is also dark in the pandemic, but there is a glimmer of light. Even with the vaccines rolling out, there is indeed in many communities a lot of skepticism. And there are many individuals who, even with the science being presented before them for a myriad of reasons, some historical, some reasons of faith, some political, there are many individuals who have made it very clear that as of right now, they are not planning to take the vaccine. And so this conversation is designed to bring some awareness and some understanding to different communities around the country, headquartered here in Philadelphia, but we are, of course, broadcasting this out to the entire country. And to begin a conversation where we're bringing together political leaders, leaders in the medical field, and leaders in the community of faith to talk about COVID-19 itself, to talk about the vaccine, to talk about the medical community, and to talk about what is being done to ensure that there is an equitable distribution of this vaccine. We'll begin our conversation tonight with Reverend Bertram Johnson and Khadijah Abdullah of the COVID-19 Prevention Faith Network Initiative, who will talk more about that initiative and set the stage for our conversation this evening. Bertram.
Thank you, Reverend James, for the warm welcome introduction. We're happy to be here and you having this very, very important event and discussion. My name is Khadijah Abdullah. I'm a part of the COVID-19 Prevention Network. I am a faith ambassador with the network. Next slide, Bertram. So I'm the founder. So I'm the founder of Rahma, which means mercy in Arabic, and our work is about around Muslims who are positive for HIV, and we try to address stigma and raise awareness and create safe spaces. And out of Rahma evolved Faith HIV/AIDS Awareness Day, and our goal is to engage faith communities across the nation to address HIV stigma in their faith communities. But most recently, I'm part of the COVID-19 Vision Network, and our role is to really engage faith communities and discuss COVID-19, prevention methods, education, awareness, and mistrust, and try to find a common ground on how we can survive this pandemic and, learn about what's going on and educate our communities and follow CDC guidelines and keep ourselves safe and alive. Bertram, you're muted.
Thank you, Khadija. My name is Reverend Bertram Johnson. I'm on staff at Union Theological Seminary, where I serve as interfaith minister, which means basically I'm a chaplain to seminarians. And I've come to this work as a faith ambassador for the COVID Prevention Network. I have years of experience in working with people living with HIV, and actually chaplaincy was the first way that got me into that work. And I've understood through the course of my career how important faith communities are in addressing issues of illness, disease, fear, and distress in our communities. And so we're grateful to partner with the UPenn site and the Black clergy of Philadelphia for this important gathering tonight. I also want to say that earlier today I was in conversation with a dear friend of mine, a mentor, a pastor in the city of New York, who's been battling COVID for the past 3 weeks now. He's not been hospitalized, but his life has been impacted by it. And so I come, and Khadija and I come not here as experts, but as people who are community members whose lives are definitely impacted by this virus. We also work with a network of research sites across the country. This is a national effort, if not international, but there's 72 sites engaged in COVID prevention research right now. And we're grateful for our partners at UPenn for their work and leadership in this effort. When we first had this conversation back in November, these were the stats. There were 11 million people who'd been diagnosed and about 248,000 people who had passed because of COVID. These are the statistics today. We're now over 16 million cases of coronavirus, and over 300,000 people have died from COVID-19. And faith communities, Christian, Jewish, Muslim, people of good heart and goodwill are vital in that work. And Khadija will share with you more of what we're doing with the COVID Prevention Network.
As Reverend Bertram said, this is something close to our hearts. You know, I've lost people, unfortunately, to COVID. And we also have an Imam that's part of the network who's actually currently battling COVID. So please keep him in your prayers. He's really a community server. He works hard to help the community. Now he's fighting COVID. So please, please, please pray for him and for his healing. So the COVID-19 network, our goal again is to, establish and maintain a faith-based advisory council. So we provide guidance and direction for community engagement. So we have a plethora of resources that you can use to educate your community. We can come out ourselves, myself, or Reverend Bertram, and lead a live for you like this, our educational session on COVID, the updated information, things about vaccines, about mistrust, about community engagement, about education. We're here to help you with that. We know when it comes to faith, sometimes talking about vaccines or pandemics can be a stigmatizing topic or tricky to navigate. So we're here to help you with that. And our goal is simply a national faith-focused COVID and COVID-PN education program. So diverse faiths, I'm Muslim, Bertram is Christian. So we really try to have at least some diverse faces as part of this program to reach all faith communities. And, we make sure that we are integrating anti-racist, anti-xenophobic, anti-homophobic, and good practice principles to really, really get our work out and our educational efforts out. So the ambassadors are 1, 2, 3, 6, 7 of us, to count it real quick. And we're dispersed across the US. And Reverend Edwin Sanders is the lead of our group of faith leaders. And, I'm based in DC. Bertram is in New York, some right now on the island somewhere. And our goal is to bring science into faith. I mean, science is, really strong. It has evidence, it's backed. So trying to find a correlation between faith and science to get the message out. And we're establishing and enhancing networks of faith leaders to conduct these educational activities. So far, myself, I've done about maybe 9 to 10 activities on Facebook Lives, just one-on-one. I have a series called Imam and COVID that I do every Thursday, but now we're on break. And we bring in the Muslim community and we discuss different topics, whether it's healing, whether it's stigma, whether it's intimacy, whether it's dealing with racism. So I really try to bring in our reflections from our community and discuss this, and at the same time, provide educational efforts. And then we have consultants. So for example, one of our faith consultants, I mentioned, he's battling COVID, but their goal again is to go out and address their community and really raise awareness and provide education. And we're here to support them. So again, we have a plethora of resources that we can provide them to talk to their community, and it can be tailored based on your community needs. So if you're gonna talk about, we're working with the elderly, or talking about vaccines, or talking about different things, we have the information to provide you so you can have these conversations. And again, like we're trying to have culturally competent information, so we make sure we base it off of the different faith communities we're working with. So it wouldn't work to have information about Christianity for a Muslim population, for example. So we try our best to make sure that we're really culturally aware of what's going on, providing accurate information. And then, we kind of have a model we follow and strategies to really mobilize the faith communities and represent and make sure you have really accurate information that we're providing.
So I just want to say briefly, there are ways that faith leaders or folks in the community can help in this effort, is to invite one of us, as Khadija said, to offer an educational opportunity like we're doing tonight. Encourage your congregation and community to follow the guidelines to prevent the spread of COVID-19. And so as we know that vaccines are now available and will be rolling out, and so we know there's a lot of myths and mistrust around it, and so we hope that we can address some of those tonight. And if you have any questions, visit preventcovid.org for more information. And also, you can reach out to us here, Bertram at Justice Associates or Khadija at havrama.org. And thank you, and we turn it back to you, Reverend James.
Thank you so much, Reverend Johnson and Ms. Abdullah. Our conversation tonight will mostly be generated by your questions. We have a great group of panelists who are here to help to answer questions, hopefully to do our best so that you can carry those answers back to your families, back to your communities of faith, and to help individuals who are under your care to make some really important decisions. I'm going to introduce the other panelists that are here that we have not heard from now. And following my introduction, the last panelist that I will introduce will be Dr. Florence Montpellier. She's going to give us a presentation from the medical side concerning the COVID-19 vaccine, and then we will open the session up for questions. We are very excited to have with us tonight Congressman Dwight Evans, who represents Pennsylvania's 3rd Congressional District, which includes Northwest and West Philadelphia, and also parts of North, South, and Center City, Philadelphia. Dwight Evans is my congressman, and so we are very excited to have him here with us tonight. He is a part of the Ways and Means Committee and the Congressional Black Caucus. He previously served the State House of Representatives here in the state of Pennsylvania for 36 years. He is a Philadelphia native, having graduated from Germantown High Community College and LaSalle University. And so welcome, Congressman Evans.
Thank you. I'm really enjoying this opportunity to join you this evening in this very important decision. In Washington, D.C., I sit on the subcommittee of health, and the subcommittee which basically oversees a lot of what's taking place here today. And this conversation is very appropriate at this particular time because there are 59 members, a part of the Congressional Black Caucus. The current chair is Karen Bass from California. The new chair will be Joyce Beatty from Ohio. And I share with you, this is a priority of members of the Congressional Black Caucus. There is a person leading the equity issues, Barbara Lee from California, leading the issue around equity. And I know that President-elect Biden has an equity leader on his task force, which is very essential. And I know Senator Harris, Vice President Harris, also has raised the issue about equity. So it's good to have this kind of partnership because the historical aspect, particularly the African-American community of color, has been one of mistrust. I don't have to tell you that because of the Tuskegee experiment that basically has left a real bad taste and a trusting aspect in our various institutions. So I'm here this evening to be a part of this panel for us to have really honest, straight talk to our constituents and to talk to them about any questions and knowledge they may have, not to be rose-colored glasses in any way, but for people to understand the necessary of this dangerous virus. the fact that over 300,000 people have died, and particularly the effect that it has had on communities of color. So it is very appropriate this vaccine has now started to be distributed, and it's something that we need to ensure that the distribution is something that is assured that it gets to the people who have the greatest needs in terms of the priorities.
Yes.
And I'll show you from the position that I sit in, joining this panel today, is to join with you collectively and to send that kind of message, because it will only be unless we collect it together. One of the things that Vice President-elect Biden said, let's fight the virus, not each other.
Oh.
Let's fight the virus, not each other. And the reality is that's something that we have to do. And that's something I want to have that kind of conversation, because this is very new. When you think about it, there hasn't been this type of pandemic in 100 years.
Yeah.
And I don't think any of us around to have figure how to approach or to treat this is even new. I've only been in Congress for 4 years, though I've been in the legislature state for 36 years. Never in my experience have we had an experience like this and the impact. So if you look at, in the case you mentioned Philadelphia, if you look at the issue of the virus on top of the poverty, you can imagine that has had huge effects on us. And in Washington, we're now trying to debate over trying to come up to a relief package, because this is going to be a question about needing resources. We're not going to be able to do this without resources. So I share with you the role I see myself, as well as other members of Congressional Black Caucus and Joyce Beatty, as well as Karen Bass. I know that if they was here, they fully would say to you that they're on board to figure out how we can get through this. Again, I'd like to thank you for the opportunity.
Thank you, Congressman. We appreciate that. We're going to get back to all those issues that you brought up. Let me introduce just real quickly the rest of our panel. Reverend Dr. Donna Lawrence Jones, who is the founding pastor of Cookman Beloved Community Baptist Church in West Philadelphia. Reverend Jones is also the executive director of the Metropolitan Christian Council in Philadelphia, a church foundation that resources faith-based nonprofits, leaders, and congregations in the city of Philadelphia. So we are so excited to have Dr. Jones with us today. We also have Imam Kaiser Abdullah, who is an assistant professor of adult and organizational communications program at the Department of Policy, Organizational, and Leadership Studies at the College of Education at Temple University. He teaches undergraduate courses in leadership, communication, research methods, classroom conflict and classroom management, and field practicum. He is also the Imam at Masjid Quba, where he serves as the chairman, and is the COO of the Quba Institute, a 60-year-old organization that establishes social institutions that support the Muslim community in the Philadelphia area. And so grateful to have Imam Kaiser Abdullah on with us today. This being a faith conversation in the Black community, it just wouldn't be right if we didn't add someone to the program. And so we are so excited to have joining us tonight after a conversation today with Dr. Montpelier. We have Dr. Carmen Guerra, who is the Ruth C. and Raymond G. Perelman Associate Professor of Medicine, Vice Chair of Diversity and Inclusion, Department of Medicine, and Associate Director of Diversity and Outreach at the Abramson Cancer Center at the Perelman School of Medicine, University of Pennsylvania. Dr. Guerra is the Board Scientific Officer for the American Cancer Society's National Board of Directors and a member of the American Cancer Society's Guideline Development Committee and National Advisory Council on Health Equity. So thank you so much for taking the time to be with us today, Dr. Guerra. Last but not least is Dr. Florence Montpelier, who is the Assistant Professor at the University of Pennsylvania in the Division of Infectious Diseases. She trained in infectious diseases at Temple University Hospital and obtained her Master of Science in Health Policy Research at the University of Pennsylvania. She serves as an expert panel member in the Department of Health and Human Services prenatal HIV treatment guidelines. And during this pandemic, she has worked closely with the Penn Clinical Trial to co-lead community engagement efforts to increase racial diversity with the COVID-19 vaccine trials. And so I'll turn the conversation over now to Dr. Montpelier.
Thank you so much, Reverend James, for this introduction. And I just have a quick presentation, I'm sorry, just to provide some basic facts around COVID-19 and to also start our discussion. So I'm gonna go straight to the talk. So during our last session, we talked about COVID-19, but I'm gonna also touch on just the basic facts around common symptoms that people have, and also where we are with the pandemic in Philadelphia and how this affects predominantly the African American community. On our last talk, we talked about how vaccines were developed during the pandemic, but now that we have 2 vaccines on the pipeline, I'm going to mostly focus today on the mRNA vaccines, which will be soon available to us. I'm going to explain how they work and discuss their common side effects and the efficacy data that we have available. I am very well aware of the history of abuse in research, particularly among racial and ethnic minorities. The goal for the session today is not to convince anyone to take the vaccine, it's to provide information to help you make an informed decision around taking the vaccine. And along this line, I will be transparent. I will tell you what I know and also tell you when I don't know. I have no conflict of interest. I don't work for a particular pharmaceutical company. I'm really here as an invested physician who cares about her community and wants to provide factual information around COVID-19. So the virus that causes COVID-19 is called SARS-CoV-2. So COVID-19 is actually the disease and SARS-CoV-2 is the name of the virus. It's a new virus that was discovered last year in Wuhan, China. And after someone gets exposed to COVID-19, not everyone gets sick. About 20% of patients do not have any symptoms. We call this asymptomatic infection. And children are more likely to not have symptoms compared to adults. After someone gets exposed to a person who's infected, in general, it takes about 5 days before having symptoms. And those symptoms are mostly fever, cough, fatigue, muscle aches, diarrhea, loss of taste or smell. And for the majority of cases, those symptoms are mild and just last for a couple of days. But in about 40% of the time, people start having more severe symptoms about 7 days later, particularly with shortness of breath. And a minority of individuals, about 14% of them, develop more severe symptoms and need to be hospitalized. And 5% of patients become critically ill and need to be supported in the ICU with a respirator or other measures. The tragedy with this pandemic is that, one, the volume of infections are high. And so a lot of people are ending up in this very severe pool. But as the public health community, our goal is to keep people healthy and prevent people from being in the hospital with severe illness. So what are some of the risk factors that can lead to severe illness? Well, age is one of them. So the older you are, the more likely you are to develop severe illness, but also your baseline health. So if people have comorbid conditions like heart disease, diabetes, and kidney disease, this increases the risk of having severe disease. And as you know, unfortunately, in Philadelphia, we're going in the wrong direction. So Reverend Bertram showed the sort of the US-based data. This is the Philadelphia data. And we are actually reaching a peak that was much higher than what we experienced in the height of the pandemic in April and May. And unfortunately, African Americans share the highest burden of disease, with 33% of COVID cases being in the Black community. The more difficult issue is that although we do share the largest burden of disease, we are more likely to be hospitalized with severe illness. So out of Philadelphia, and this is the health department data that was updated up to two days ago, half of the people hospitalized in Philadelphia with COVID-19 are Black. And it's a similar picture for mortality. Out of all the deaths that are occurring in the city from COVID-19, half of them are happening in the Black community. And as you can see, the numbers are much, much higher compared to any other racial and ethnic group. And obviously, we share a high burden of comorbid conditions like heart disease, et cetera. But this is also due to other factors like structural racism and other structural barriers that are contributing to this. So during the last town hall, we discussed different mitigation measures such as the importance of wearing the mask and social distancing. Today, I'm really going to focus on the vaccines. And obviously, the vaccine conveys an individual benefit. The goal, again, is to prevent severity of illness so that people do not go to the hospital and don't end up in the ICU. And in addition to having an individual benefit, it has a community benefit because as a community, if we are less likely to have the infection, we're less likely to transmit it to others. And this allows us to return to work or kids to go back to school. And particularly because we've been hardly hit financially and economically with this pandemic. So how might a potential COVID vaccine work? Well, it can work by teaching the body to recognize and fight the invader. So here I have a picture of the virus with the spike protein, which are displayed with the orange spikes. So once the virus enters the body sounds the alarm. It mobilizes fighter cells or in proteins, which are part of the immune system, and it helps to fight off the infection. So how does particularly the mRNA vaccine works? And actually, I heard a lot from the faith community that there was a lot of concern, particularly around the mRNA vaccine. So I thought it would be important to discuss what it is. So the mRNA vaccine is a new type of vaccine that contains the information that helps our body create an immune response against COVID-19. So to trigger an immune response, many vaccines put a weakened protein or an inactivated germ into our body. This is not the case for the mRNA vaccine. Instead, the mRNA vaccine has the code that teaches our body and our cells to recognize the protein that triggers an immune response against COVID-19. So it's also important to discuss what the mRNA vaccine is not. It's not a live virus, therefore it cannot cause infection. So I'll go through the side effects, but a lot of people who end up actually close to half of individuals who end up getting the vaccine have side effects in terms of fevers and muscle aches. And it's easy to think if you have a fever after a vaccine that actually you have the infection, but it's not the infection itself. It's the fact that your immune system is recognizing the protein to help fight the virus. So the symptoms that are coming on are not due to an infection. It's due to the fact that your immune system is actually working the way it's supposed to. The mRNA does not enter the nucleus where your DNA is, and it does not alter your DNA. There's been a lot of fears about this vaccine altering the DNA, and that's not the case because it cannot enter the nucleus where the DNA is. The mRNA is destroyed soon after the cells are done using it, and in animal studies, that happens about 14 to 21 days after vaccination. So it doesn't linger around your body. So here on this slide, I'm going to focus on the two mRNA vaccines that are going to be coming down the pipeline very soon. Both of them had large enrollment of individuals. And what I really want to focus on is looking at the percentage of racial minorities who were included in this trial. So 30% of people who enrolled in the Mrna trial were non-white individuals. And 42% of individuals who enrolled in the Pfizer vaccine, now given the Pfizer vaccine was done around the world, not only in the US, but 42% of those individuals were from diverse background and 30% in terms of the US population. Now, the Mrna vaccine is 94% effective against COVID-19 infection, but the most important thing is that 100% of individuals who received the COVID-19 vaccine, the mRNA vaccine, did not end up with severe illness, meaning that they didn't go to the hospital, they were not in the ICU. So the vaccine actually performed what it was intended to do. People did have side effects, and the side effects were worse with the second injection. Both of them are 2-dose vaccines given a month apart, and the majority of side effects actually occur, or the intensity of the side effects occur with the second dose. And these include muscle aches, fever, headache, and pain at the site of the injection. The Pfizer vaccine is also very effective at 95% and has similar side effects. And again, it's a 2-dose vaccine. So there are many vaccines coming down the pipeline. The ones that will be most likely coming after the mRNA vaccines or the adenovirus vaccines with the AstraZeneca and Janssen vaccines. The AstraZeneca vaccine was found to be 62% effective with 2 doses and 90% effective with half a dose and a full dose. And the Janssen vaccine actually just completed recruitment here in the US. So we should hear soon what the effectiveness of the Janssen vaccine will be. This is my last slide. I just wanted to end by saying that African Americans have been involved in major steps of the scientific process in terms of the vaccine development. Dr. Corbett is an African American woman who works at the NIH with Dr. Fauci's team, who actually helped develop the mRNA vaccine. Although the vaccine was ready to be manufactured pretty fast, it took over 10 years actually to come up with this platform. And she's a significant contributor to this. There's been participation from people of color in the clinical trials, which is very encouraging, meaning that the data that we're seeing include data from our community. And that's very encouraging. The National Medical Association, which is the largest association of Black physicians and also the oldest in the country, created a task force for COVID-19, particularly around the vaccine, and has been serving as a bridge between the scientific community and the community at large. Finally, I'd like to thank the CoVPN and the Penn Clinical Trials Unit. And this is the end of my presentation, and I will pass it back to Reverend James.
Thank you so much, Dr. Montpellier, for that presentation. I know the presentation itself both answered some questions and probably created some questions. Let me start with one question, and then I'll go to some that we're getting out of the chat. A general question that people often have about these vaccines is that we know that there was an expedited process to roll the vaccines out. And there is often a fear, and I'll pose this to both of our doctors, a fear that the expedited process could have led to steps being missed, stepped over, that it was not as thorough. And so could either of you explain how the expedited process, just without going too much into the science of it, how it works and how a person can be confident that even though the process was expedited, that it was still thorough?
Yeah, and I can probably start with that, and I'll let Carmen also answer. So there's no need for us to develop a vaccine 2 or 3 years down the line when, you know, the pandemic would have been over and the hit rate in terms of mortality would be even more than what we would be experiencing. So the goal obviously is to balance speed, but also meet the need of the pandemic. What occurred was with the mRNA platform, we had the opportunity to do just that. However, in terms of the testing itself of the vaccine, what happened is that there are in general 3 phases that have to be done in a clinical trial. They're called phase 1, phase 2, phase 3. And each phase informs the other. What we had to do was all the trials still include phase 1 and phase 2 and phase 3 studies, but they have to be overlapped and compressed in terms of time in order to roll this out and allow us to have a vaccine available soon. So the important thing is none of the steps were skipped. They just had to be compressed in order to meet the demand of the pandemic.
Thank you.
And if I might add, what Operation Warp Speed did was they didn't wait until all those steps that Dr. Montplaisir described and then start making the vaccine. What they did through Operation Warp Speed was actually start making the vaccine as the trial launched. So now they had all the vaccine in production while the trial is recruiting patients. And then when they saw the data and saw that it was effective, then they could now be ready immediately upon approval, as we saw last Thursday, and then over the weekend start shipping the drug. Had the trial been negative, they would have thrown out that vaccine if it didn't work. So it was a big gamble on the part of our US government, but they felt very confident based on the advice of many people at their scientific headquarters, the NIH, and many other experts like Dr. Fauci, that this gamble was important to take because we had such strong science, as Dr. Montplaisir said, for 10 years before we even started to make this trial. So I think that's what Operation Warp Speed did. It allowed us to just have the vaccine ready.
Thank you. Thank you very much. So real quick, let me shift a little bit away from, we got a lot of questions that are coming in for the medical community. We'll get back to those real quick, but we do have some for the faith community. And so let me ask this question specifically to Reverend Jones and to Imam Abdullah, but Reverend Bertram and Mrs. Abdullah can chime in here. Likewise, if you want to. What are we telling our community of faiths right now when it comes to the vaccine? I think that we all know that both in the Muslim and Christian, but also the Jewish communities, the voice of the clergy person goes a long way in helping our communities to make these type of decisions. So let's start with Imam Abdullah and then Dr. Jones. Considering what you've heard tonight and the information that you already had, if a member of your mosque or a member of your congregation came to you and had some questions about this, what would be your advice to them concerning the vaccine?
All right, good evening, everyone. So I think, there were 2 questions that were asked, right? What is currently being said? And then also, what would we say now with some of the information that has been, that we've heard tonight? So I think some of the things that, the way I want to answer this is there's a lot of disparate information that you see coming out of religious communities right now. And we know that to be a fact, right? Dr. Montplaisir mentioned the level of mistrust that has happened so far. So that to a certain extent is fueling some of the information that we have being shared in some places, right? Particularly as we would see, especially in some social media places, coming out from people who are of repute in the community, unfortunately. That being said, I think one of the things that we have to do, I'll quote a local anthropologist and a colleague of mine, Dr. Donna Austin. One of the things that she said is, in our communities, we have a right with good justification to express skepticism, right? Like there's real skepticism, and I think there's a need to acknowledge that. One of the things that we also have to be wary of is, as you said, Reverend James, that religious leaders are in many cases the first or a significant point of contact for people who want answers, for people who want guidance. And one of the things that Dr. Austin, and I concur with this, said is that we cannot, as religious leaders, blindly make statements that discourage people from doing what is in their best interest. And I'll add on to that, or I'll expand on that a bit, that if we know that people listen to us, then it is irresponsible for us to simply say, well, you know, these folks, they do anything to make a buck. You know, these folks, how did it get out here so quickly? You know how things go. You know, we'll be the ones who are suffering the most. So I think for me as a religious leader, what I would do is take more of a chaplain approach to it, right? And I think Reverend Bertram, he mentioned, you know, this chaplaincy approach earlier on. I would take more of a chaplain approach to it in terms of try to give people what they need and avoid making some of the generic, broad statements, right? So based on the information we get tonight, we know that the vaccine has met certain rigor, right, to meet the needs of the community. So armed with that information, someone coming to me and asking me about this, I would say, well, based on the information I have, I know that the vaccine has met certain rigor. I know that this is what has happened. But if you have other questions, then as religious leaders, our job is to bring the experts into the room who can answer some of these questions that we may not be able to answer, right? Create the platform, gather the resources to point our members to say, hey, you know what? This is what has been said by people who are experienced to say this. Religious leaders should not be giving out medical advice unless they are also medical experts, right? And even then, we need to be careful as to how we mix some of that information, because it may not always work in the best interest of the people who are listening to us. So I think it really is to take a case, a broad perspective on it, that understanding some of the information that is out there, but also to really take it on a case-by-case basis, because everyone is not going to present with the same need in that moment. So I think that would be the best way to go about it, and I can stop there, hopefully.
Oh, wonderful. Thank you so much, Imam. Dr. Jones. Unmute yourself, Dr. Jones. I'm sorry.
I would say that I concur with everything my brother, Imam Kaiser Abdullah, just said, definitely. And also looking at doing the additional work that we have to do anyway as we're ministering with people to know the facts. So for instance, early on, people within the Christian community were concerned about, is there fetal cell tissue or anything involved in these vaccines? Or I've got friends with Jehovah's Witnesses that were concerned about blood. So it's to our advantage to just really not only stay up with what our particular denomination or community is teaching, but also to look at that larger community within our faith, because our people can get mixed signals. And if we know that some people are told that they're using fetal cells, some people are told that other things that are out there, if we're up on what our larger community is talking about, then we can better be that chaplain that Imam Kaiser spoke of and address and dispel some things. The other thing that I believe is pretty natural for many of us is that we can promote faith. And faith and we have a language for promoting faith in the doctors and in God's ability to work through the medicine and through the science, and to celebrate the miracles of the science is another way of just encouraging people. And lastly, to encourage people around doing what's best for their families. And that's very critical. So, you know, reminding people that it's not just for them. It's for them, it's for their children, their grandchildren, their parents, and so forth.
Thank you, Dr. Jones. Just because you take a pill, or in this sense a vaccine, does not mean it wasn't a miracle. There is a balm in Gilead.
Yes.
And miracles do happen through a conduit sometimes. Let's bring Representative Evans back into the conversation. Representative Evans, if there is one single thing that has happened that has relieved some of the fear, especially in the African-American community concerning the vaccine, it has been the election of Joe Biden. And while that has nothing to do with the vaccine itself, just knowing that Joe Biden will be making or leading many of these decisions will alleviate some of these fears. I'm wondering if are there any conversations that are going on the national level about the rollout and about making sure that there is an equitable distribution, especially to some of the communities that are normally find themselves in having difficulty getting access to healthcare. Particularly, I don't know if this has been a part of the discussion, but some of the vaccines that are coming on later are a little cheaper and less effective. And so a part of what hits the streets is that perhaps those vaccines will be the ones that are made available to the African American community, and not the Pfizer and Mrna vaccines that are more effective. Are there any discussions happening about that on the federal level?
The answer is yes. And I think when you asked that question, which I thought was a very appropriate question, look, there's no question that a change in administration is not magically going to change the feeling, particularly in the community of color. You know, just electing Joe Biden will not do it in itself. But I think the essential part, as I have been listening, is very important to listen first and then attempt to address various concerns and questions that people have. I mean, we have a long way to go to try to attempt to deal with the mistrust first. I mean, that's built there. And by having this panel that you have it today is a start to chip away. There have been suggestions made. One of the suggestions, I think Dr. Smith is a person from Yale that Vice President, President-elect Biden appointed a part of his health team as an equity person at a national. What I also was saying to you earlier is as important as a priority of the Congressional Black Caucus of the Black Caucus itself is also very vigilant. So I'm sharing with you through the Biden administration, the Black Caucus, there's far more aggressiveness to pay attention to this. And I would advise and encourage people wherever they are throughout is to touch base with it, just to challenge to raise questions. If you got questions, I would definitely, because this is new for all of us to understand what it would take. So the question you asked is, will it be less? The answer from our perspective is no. I don't believe decisions can be made that bit. Our basis is to be vigilant and to make sure that the best is received.
Thank you, sir. Quick question directed to our doctors again. I'm going to take a question that we had and kind of reshape two of them together. Sometimes when people hear that there are greater deaths resulting from COVID-19 in the African American community, they don't know exactly how or why that is. In other words, is it because African Americans just have some genetic abnormality that makes them more susceptible? So the two questions are kind of both asking the same thing. Why is it that when an African American person contracts COVID-19, that they are more likely to either get more sick or to die?
I can start with the answer, and I'll let Carmen answer as well, because she's worked on that too. I think it's not due to one factor. I think there are a multitude of factors that are sort of layering out, and we call it, in the biobehavioral world, sort of syndemic. So it's basically micro epidemics that are coming together and creating this environment where bad outcomes are happening. There are a couple of things. One is the fact that very early on in the pandemic, African Americans, particularly because of the types of jobs that we have, didn't have the protection necessary to protect themselves against COVID. I've had patients come to me and say, listen, I've had to work and they're not providing masks, like it's just not available. These were very common things that were occurring early on in the pandemic, even when we knew that masks were important to be worn. There's also the fact that, so in terms of the differential exposure, that I think a lot of there are structural barriers that are contributing to this. And then the fact that, the comorbid conditions are poorly controlled in our communities, mostly because of access to care issues, again, structural racism, and not having access to preventive care, which would really decrease or basically improve our baseline health. So by the time we're getting to the hospital, we're already at higher risk of being on that severe degree of illness based on the graph that I showed earlier. And so I think that there are multiple things that are really coming together to make it to contribute to those disparities.
I don't have very much to add. The only other thing I might add is that sometimes where communities like mine, the Latinx community and the Black communities live, they might have access to hospitals that sometimes don't have all the technology that some of the other hospitals that are in wealthier parts of one city sometimes has. So their local community hospitals and the care may be different as well. So that's another possibility as well.
Thank you very much. Kind of reminds me of the old adage that when, white America catches a cold, Black and brown America catches a flu. And so much of that has nothing to do with genetics. It is just a stringing together of so many factors that lead to different health outcomes in our two communities. Let me pose this question to the entire panel. Anyone who wants to jump on is able to do so. There's a question that has come asking about some of the tools that are available, some of the resources that Dr. Jones talked about, some of the resources that might be available to help educate someone. So if either a clergy person or a person who's on this line is looking for some resources that they might use, what are some resources that you may have run into? Khadijah and Bertram have already given us some resources, which would be the COVID-19 Prevention Network itself. But what are some other resources that people might be able to take advantage of right now?
Unmute. I'll speak a little bit to that. I know for what I found helpful is the CDC website and the WHO, the World Health Organization, and looking at things that compare and contrast both the vaccines that are coming out, as well as information that compares and contrasts the COVID vaccine with other vaccines, like for flu and things like that. That's helped. I've also benefited by going on fact check sites that might list, there are various ones out there, routers and others, that list, these are the things people are saying and these are the facts. So just being a little bit intentional about checking.
Nothing to add to what Reverend Donna has said.
I would also suggest, I live in New York, but the New York State Health Department has ongoing updated information. And as the vaccine rollout moves closer to implementation, I would encourage folks to look at what the state of Pennsylvania and the city of Philadelphia public health departments, how they're engaging folks in vaccination access.
I think I do have a question though for Representative Evans and others around how resources are being distributed to ensure up the public health education side of this. What is going on in the area of good old-fashioned public health organizing to ensure that the information is getting to the deepest parts of our community with people who could be trusted messengers?
I would say to you, there's still a lot of work to do. As you read in the media, I'm be very frank with you, I don't think we are doing a good job in Washington in the distribution. You have on paper where President-elect Biden is talking about 25 billion initiative he's pushing. But the question is, what you're raising is, it doesn't mean anything if it doesn't get down to the people who need it, is what I think the question you're asking. And what I'm saying to you, that's going to take more and more work, not excuses. The idea of the vaccine is supposed to be with no cost for the vaccine. But I'm saying to you, there's more work we have to do. If you go by just this relief package we have, which personally I'm rather embarrassed, we should have a relief package to people out there now. So it's still a work in progress. And I don't know if that answered very specifically because it needs to be done now, but it's still work. It's still an awful lot of work that we still have to do. And as Pastor said earlier, just the change in the administration will help light years to get the immediacy. That's one of the most key elements that has taken place, a change in administration to get it. But still some work to do. There's a lot of things on paper, but to me, it doesn't mean anything until actually it makes contact with people. That's what will really mean something. So I want to be very honest and straight up with you. There's a lot of things talked about, but it doesn't mean anything until it's actualized among people. I want to piggyback on something over hospitals was said earlier. That's another greater issue because in the case of Philadelphia, over the last 20 years, we lost a lot of hospitals. And there's a distinction between what you call safety net hospitals and non-safety net hospitals. So that is equally as important to make sure that hospitals are viable and available.
Thank you.
Thank you. Thank you so much for that question. Anyone else? Resources that are available? Okay, we've got another question. This would be for our doctors, and this is around if someone has already contracted COVID and therefore they have the antibodies that the body would naturally develop, does that person need to get the vaccine as well? And will the vaccine be effective for those individuals?
So I would say yes. The vaccine is important even if you were diagnosed with COVID-19. And there are several reasons for that. One is that the majority of people who get infected, particularly when they have asymptomatic infection, it looks like their antibodies are not necessarily long lasting. There's been a couple of case reports in the scientific literature where people got reinfected. And so it's one reason. The second reason is that although we're still learning about that, but theoretically, the vaccine should at least mount an immune response that would be protective. Now, we don't know for how long it would be protective. We are making, we're hoping that at least for a year, it'll protect individuals. We're still learning because this is a new virus. But if you look at the studies, when they compare the levels of antibodies with natural infection, meaning that people just got infected by being exposed to others versus by getting the vaccine, there's at least a 4-fold increase in antibody titers, meaning that the immune system or the immune response is much stronger with the vaccine and would be more protective. So I would say even if you got infected, still get vaccinated.
All right, Dr. Guerra is shaking her head yes, so I'm glad she's on board with that. We have come to the end of our time, so let me ask just one more general question. I will put that out for everyone. First of all, I wanted to suggest to Representative Dwight Evans in response to Dr. Jones' question about getting the word down to the street level. Anything that you can, anytime you can engage Black Twitter in getting things out there, Black Twitter will get the word out to all of Black America within at least 24 hours of any situation. But here's our final question, and this comes off of the Facebook Live. Someone who is on Facebook Live is just talking about trust in general. And I thought that Imam Abdullah did a really good job earlier when he mentioned, and Dr. Jones as well, that our faith in a situation like this is not just faith in God, but it is also faith in our healthcare workers, faith in our institutions, faith in our politicians, faith in people like Dwight Evans, who we've known in our community for a long time, and faith that those individuals, faith in our doctors, faith in the two doctors that you see on this call right now, that they, being people from our community, being people who grew up in our communities, that these individuals are gatekeepers. They are looking out for you. They have your best interests at heart. And they are not just going to come and present something to you where they have not themselves done the research that's necessary. So I'll leave this to honestly to whoever would just like to jump in real quick with a statement of how you understand, especially in this dark season that we're in right now, what are your sources of faith, even in the wider medical community, national community, and what's going on? And what would you say to someone who is struggling right now with trust?
I would say, from my perspective, from a government perspective, that it has to be a sustainable effort, not just one and that's it, one and done. Either my office, I'm fully committed. I want to be sure. I want to say that up front, because I think it's going to take that kind of sustainable effort. I had the pleasure of serving with John Lewis, and John Lewis, the late John Lewis, used to always say, if you don't think things have changed, just walk in my shoes. I saw John Lewis when I was 10 years old, 10 years old. And I had the pleasure of serving with him in the United States Congress. And now he's no longer. That is, as a people, that is our struggle to be sustainable, to stay with it. We know there's been unfortunate, but we must stay relentless. That is the element that you say, faith. We must stay with it. And that will, in return, in my view, begin to build some sense of hope.
Thank you, Congressman.
Go ahead, Reverend Donna, and then I'll say something.
I was going to say, I also, when Representative Evans talked about being relentless, to be internally relentless about building relationships with all of our healthcare professionals, our doctors, our nurses, so that we build trust through relationship. And sometimes we're too quick to get out of the office because we don't want to be there in the first place. But when the doctor asks how things are, you can ask the doctor the question, ask the nurse, the PA, the NP, whoever it might be. This is a great time to pull on coattails and demand some time so that we can have a better understanding, which also builds trust and faith in each other.
Absolutely. So in addition to building these relationships, right, there's this saying of the Prophet, peace be upon him, that says that there's no disease for which a cure hasn't been created. And I think that to a Muslim who might be leaning into, well, how do I know that I can trust this? Or how do I develop more trust? I would say, you know what? Lean into the question that you are having. It is okay to be concerned. It is okay to wonder, okay, is this okay? But it's also necessary to develop those relationships that we've been speaking about, and not to take information from anyone who doesn't have the responsibility of giving, and I didn't say right, who doesn't have the responsibility of giving that information. Pick the people whom you trust and lean into them, rely on them, and have the conversations with them that you may not necessarily find in a 280 letter statement online.
Thank you all so much. I have been, like most of us, Zoom for the last 9 months. But this has been the most beneficial hour that I have spent on Zoom in these conversations. Thank you for bringing all that you do. Thank you, Representative Evans. Thank you to these two brilliant sister doctors that we have on with us. Thank you to our clergy people. Thank you to Reverend Johnson and Ms. Abdullah from the COVID-19 Prevention Network. Thank you all so much for being a part of this conversation. We are going to continue this conversation as long as this conversation is necessary in our community. We will find time and space to make sure that this is available to you so that we can give you what you need and to make sure that you have this. And there's some other things that are coming up. We will make sure that we have additional conversations so that we can talk about this. So thank you for giving us your time tonight. Thank you for your prayers. Our prayers are for all the families, all the communities that are affected right now, for those who are in hospitals, for those who are on ventilators. I know that we all have a name that we could call right now. And to whoever and however you pray, please let's keep our communities in our prayer right now. Thank you all so much for being with you. And may the peace of God be with you in this season.
Amen. Thank you.